Good day everyone, welcome back to our YouTube channel. I still remain Adegbite Olushola. Please, if you are yet to subscribe to our YouTube channel, please do so by clicking on the subscribe button as well as the notification button so you can get notified whenever we post a new video. Please, thank you for watching our videos so far. Thank you for liking them. Thank you for commenting on them. Please, if you are yet to subscribe, quickly subscribe as soon as possible. Yes, today I bring to us a very exciting topic. A common condition that is occurring in our environment, especially that occurs to couples. Yes, and I want us to understand the true perceptions of this. I want us to erase the false perception of this topic. I want us to erase the false perception and accept the new facts about this topic. And the topic is infertility. Infertility. Yes, I know that a lot of us, this word is not new to us. This condition is not new to us. It is a condition that is very common, and it is the inability of couples to bear a child after unprotected sexual intercourse for 12 months and above. Which means that if you are a newlywed, you just got married and in 3 months you are yet to get pregnant, do not panic. Yes, you still have a chance. It is not yet infertility. But once it is 12 months and above, yes, we can consider it as infertility. So it is inability of male and female or couples inability of them to get pregnant after unprotected sexual intercourse for 12 months and above. So there are different causes of this condition, but a lot of us used to believe that we have this false perception that female is the main cause of infertility. If there is infertility, if the couples are yet to get pregnant, they always put the blame on women. No, I need to let us understand today that women is not the cause or is not the only cause of infertility. They are not responsible for getting pregnant. Likewise, they are not responsible for giving a male or female child. Yes, but that's another story for another day. So let me make you understand that women are not responsible for infertility. Men too can be infertile. Yes. So what are the causes of infertility? I'll be grouping them in male and female. I will not want to talk about it generally. So what are the male factors that causes infertility? The number one point I'll be talking about is azoospermia. Azoospermia is low production of sperm. As we all know that sperm is a short word for spermatozoa, which is the male cell of the male reproductive organ. So when spermatozoa is being released during sexual intercourse, it flows to the lady's ovary. Inside the ovary we have the ova, which is the egg. So there will be fertilization. It will move to the ampulla region. There is a region we normally call in the female reproductive organ known as the ampulla region of the fallopian tube. There it will fertilize itself and come down to the uterus to embed in itself. The fertilized egg will embed itself in the uterus for growth. Yes, for nutrients, for growth, and that's where we have in the uterus, which is also known as the womb, we have the child and the placenta. So that's a story for another day as well. I don't want to deviate from what I'm talking about. So azoospermia is low production of sperm cells. When there is low production of sperm cells, it is possible that the man will not be fertile, to lead to infertility. One of the causes of infertility is azoospermia. Another cause is vas deferens defect. The vas deferens is also the spermatic cord that comes from the epididymis to the urethra. The urethra is the passage, the tube where the spermatozoa moves outside the penis. And also we can have the urine also through the urethra. So the vas deferens is the cord that takes sperm from the epididymis to the urethra during ejaculation or sexual intercourse. So once there is this defect of this cord, the spermatic cord, definitely there will be infertility. That I'm still talking about the male cause of infertility. Another one is oligospermia. Oligospermia is fusion of spermatozoa. When there is fusion of spermatozoa, or there is damage to the duct, or there might be damage or defect during spermatogenesis. Spermatogenesis is the process of sperm formation. Yes, the sperm is being formed. During the sperm formation, there might be defects which might lead to infertility. This is another cause. So oligospermia is either the fusion of spermatozoa. When there is fusion of sperm cells together, there won't be enough way for them to flow to the ovary where there will be fertilization. So that's another cause of infertility. Another cause of infertility is sexually transmitted infection. When there is sexually transmitted infections like syphilis, like gonorrhea, and other infections like that, it will affect the sperm. It will reduce the strength of the sperm, and it will reduce the ability to flow, or the ability to be more fertile, the ability to be more potent, to be able to fertilize the female egg, which is known as the ova. So sexually transmitted disease, when not even treated early, it might damage the male reproductive organ, or might kill the male reproductive cells known as the spermatozoa. Another cause is excessive exposure of the testicle to heat. The testicles is a structure inside the scrotum. The scrotum is what we see, the two balls below the penis that is attached to the body, attached to the two balls, where we have the testicles inside the scrotum, where there is production of spermatozoa. So when there is excessive heat, exposure of heat to these testicles, it might damage or affect the spermatozoa, or it might damage or affect the production of these sperm cells, leading to infertility in male. So we can see now that female alone is not the cause, or they are not responsible for childbearing. Male also are responsible for childbearing. Another point is mental unrest. When you are mentally unrest, you have a lot of things, stress, you have a lot of things, you are going through challenges. It can also lead to infertility because you are derailed, you are stressed, your body is stressed, you are weak. It will affect your what? Infertility. Then another one is faulty coital techniques. Faulty coital techniques, that is faulty intercourse techniques. When a man, especially those that are new to having sexual intercourse, they don't have the good techniques in which they can have sex with their partner or their women. So it might lead to infertility as well. Then another cause is lack of ejaculation or premature ejaculation. This is where we have this common word that people use, that 1 minute man, 1 minute man. And when a man is unable to ejaculate, or when a man is unable to have sex for longer period, for them to be able to ejaculate and produce sperm cells into the vagina of the woman, so it can lead to infertility as well. Excessive intake of alcohol can lead to infertility. Yes, excessive alcohol does bad, does the worst part into the male sperm cells. Yes, it can kill these sperm cells it can kill the sperm cells. One of the ways you can know that alcohol is a bad option is you taking a liver of a meat, put it in a very clear or a transparent plate or a transparent whatever you want to use, and pour alcohol, leave it there for a few days and see how the liver will turn to, it will shrink. So alcohol, excessive of alcohol can damage the sperm cells. Another one is undescended testes. Undescended testes. Yes, this could be as a result of congenital malformation or congenital abnormalities. When the testes is not in a normal position, is not structured in a normal position, it can lead to what? Infertility. Why? Because there will not be good production of sperm cell. Another point is also mumps. Having mumps at puberty. Mumps is a condition whereby the cheek will be swollen. Mumps in Yoruba, they call it gege or gege, I think so. So it usually occurs to children at puberty age, because it is contagious. So when they contacted it from a friend of theirs in school, they will come home. But a lot of us, we are dumbfounded. We have this false perception that mumps should be treated locally. Some of our women, our mothers or mother-in-law, they make use of dry corn. They will chew it and they will do twe, or they will try to pour out this dry corn on the cheek where there is mumps. It is not the right thing. Go to the clinic. Although mumps itself can go itself without you treating it, but it is very important. If it does not go, maybe for few days, you need to visit your doctor so that they can find solution to it. It causes infertility. So mumps at puberty is one of the cause of what? Infertility. Now moving to female cause of infertility. Yes, female cause of infertility. We have different causes as well. We have different causes of infertility in female. Number one is unruptured hymen. Hymen is the lining, or let me say is a membrane that covers the face of the cervix. We can see hymen in a virgin girl, a virgin lady. That is, there will be membrane covering that cervix. So once this membrane is being cut after having sexual intercourse, being a virgin, there will be bleeding. There might not be bleeding, but there might still be bleeding, and that's why people believe that any lady that is a virgin has to bleed once she has sex. No, at times there might not be bleeding once the hymen is being ruptured. So unruptured hymen can also cause infertility in women, in the sense that it will block the spermatozoa from entering the uterus. We have vagina before the uterus. The vagina is also like a space there. So if the hymen is covering the cervix or covering the face of the vagina, there might not be perfect flow of spermatozoa. Another cause is absence of uterus or absence of womb. Yes, it is a condition. Some people have this condition. There will not be womb at all. There will not be uterus. It could be as a result of congenital abnormalities. There will not be womb at all. Yes, it can lead to infertility, because once there is no uterus, how do the baby wants to form, or how will the baby grow? Where will the baby grow? It is the uterus, and there is no uterus, so it can lead to infertility. Another one is excessive anxiety and worries. It's just like the male part. We said mental unrest. When there is excessive anxiety and worries that, I am not fruitful, I am not fertile, so it can also lead to infertility. Then another one is ovarian tumor. When there is abnormal growth in the ovary, The ovary, we have two ovaries, we have left side and we have right side. Once there is ovarian tumor, it can lead to infertility, because the ovary produces the egg, the female egg cell. Yes. So once the female egg cell is not produced, how will the sperm penetrate into the cell to fertilize it? It's not possible. So once there is ovarian tumor, it is possible that a woman will be infertile. Another cause is hormonal imbalance. Hormonal imbalance is one of the major causes of infertility today. Hormonal imbalance may occur on its own, while there are some hormonal imbalance that is caused as a result of a woman's lifestyle. For example, misuse of contraceptives or emergency pills can lead to hormonal imbalance. When a lady that is not breastfeeding is having fluid, especially like a milk fluid in the breast, it is as a result of hormonal imbalance. Yes, because it shows that there is excessive prolactin hormone in the body of that lady. So it will prevent the woman from getting pregnant through making the woman not to have menstruations, or it will delay the menstruation, or it will make the menstruation irregular. It can lead to infertility. And another point is uterine factors like malformation of the uterus. When the uterus is being malformed, is not the regular way which the uterus is meant to be. Yes, it could be as a result of congenital malformation as well. There are some uterus that the structure, the way they are meant to be, they will not be like that. Probably there might be shifting sideways. So once they are being shifted sideways, the spermatozoa, once it is entering, it might not easily find its way, because it is meant to go straight. It might not easily find its way into the uterus, thereby causing infertility. Another one is infection of the uterus. When there is infection of the uterus, it can lead to infertility. Infections microorganisms are very dangerous. They might kill the sperm cells. Another one is cervical infections or cervical cancers. So it is very important as a lady to always go for checkup, for pap smear checkup, to ensure that your cervix is not cancerous. So another one is the growth in the uterus. When there is abnormal growth in the uterus, tumors or in the uterus, it can also lead to what? It can also lead to infertility. We can also have blocked tubes. These tubes, like the fallopian tubes, we have in two ways. When there is when there is a foreign body or something, or infection is in the fallopian tubes, it might block those tubes, preventing spermatozoa from entering the ovary. So these are the causes. There are a lot of more causes. There are more causes, but I'm just talking about the major causes of infertility in women. Yes. So what are the ways in which we can prevent this? Before we go there, I will talk about more causes, like for example, injury, maybe as a result of accidents, can also be a cause. Then also malnutrition can also be a cause when not eating adequate diet, because adequate diet helps the immune system majorly, and the immune system helps to prevent the foreign bodies, infection microorganisms from invading the body. So once there is invasion of microorganisms, it can block the tubes, it can infect the uterus, it can kill the sperm cells, and so on like that, causing infertility. Another thing is prostitution. I'm not talking against it. I'm not saying much, but prostitution can lead to it can cause infertility, in the sense that when you are jumping from one man to another, you are sexually active, you tend to have sexually transmitted diseases or infection, thereby causing infertility. Another one is increasing age. That is, you are getting older, And once you get older to a certain age for menopause, it might be very difficult for you to bear children. So it might lead to infertility. Then another thing is lack of knowledge. Lack of knowledge of the reproductive systems. There are some females that they don't even know when they are ovulating. They don't know when they are menstruating. They don't know when their safe period is, which is wrong. So lack of knowledge from both the husband and the wife can also lead to infertility, because they might be having sexual intercourse at the wrong time. Yes, at the wrong time. If you are having sexual intercourse during safe period, where is the egg coming from? There won't be release of egg. But if you are having the sexual intercourse during the ovulation period, you tend to there will be egg, release of egg from the ovary, and it is very easy to have baby through that period. And another thing is infrequent intercourse. You want to get pregnant, but you are not having sexual intercourse. How do you want the baby to come? It might not be possible. So with this point, I believe I have opened our eyes to see that women is not the only cause of infertility. They are not the ones to be blamed when there is no child in a marriage. Then what are the ways in which we can prevent or manage these conditions? Is through regular checkups, tests, scans, X-rays to check for deviation from normals of these organs, of these reproductive organs. Then we can also manage these things like using fertility drugs. There are fertility drugs. Meet your doctors or your nurses to prescribe these drugs for you. Then another thing is being educated on having knowledge on when to have sex during your ovulation period and when not to have sex, so you will not be doing the wrong thing, so your perceptions will be opened. Then another thing is that as a lady, you need to know whenever you are ovulating. You need to understand your body. You need to understand that there might be discharge, especially like egg white discharge whenever you are ovulating. You might be having tender breast, you might be having fever, you might be having mood swing whenever you are ovulating. Then another thing is seminal analysis, that is the analysis of your sperm. You will be asked to bring your sperm. They will take it to the lab for thorough checkup. They'll carry out sperm count. They'll carry out the test to know the potency of your spermatozoa and to know the drug or the treatment to be given to you. Because once the underlying causes is being known, then it is easy to find solution to these conditions. Then another point is that stop misuse of drug. It is very essential. Stop misuse of drugs. A lot of ladies now, they have turned emergency contraceptive pills to paracetamol, which they take every day. They have turned into sweets and chewing gum that will be chewing every day. It destroys the hormonal imbalance. It makes your hormone to be imbalanced when you are misusing it. I'm not saying that these drugs are not good. They are good, but when you misuse them, it will cause what? Infertility. It will change your hormones. Then another thing is, whenever you are looking out to get pregnant, be calm. Be calm, prevent anxiety, prevent mental stress. A lot of women, all they do is to cry every day because of pressures here and there. You need to be calm every day. You need to be calm for your body to be prepared. You need to prepare yourself for what is coming. You don't need to be scared. You don't need to be anxious or putting yourself to troubles or worries. Worrying yourself is, you don't need. So then also you need to cooperate. There should be cooperation between the couples. Husband cooperate with your wife, wife cooperate with your husband, and the both of you will cooperate with your doctors. And don't hide anything from your doctors. Don't hide anything from your doctors. Yes. And another thing is, stop practicing abortion. I mean, the wrong abortion. There are a lot of people that whenever they want to abort children, all they need to do is to buy drug, use drug, insert drug. It might damage your womb. It might damage your womb. Avoid it. Avoid. It's very common in our society, especially among the young ones coming up. Whenever they are pregnant, they tend to use, they tend to abort in the wrong way. Then another thing is adequate diet. If you're eating well, and you are practicing safe hygiene, personal hygiene, environmental hygiene, you're good to go. These are one of the ways we can prevent this condition. Then another thing is with safety precautions. Safety precautions from injuries of the ovaries, from injuries of your testes, and so on like that. Then have knowledge. Increase your knowledge. Go ask your doctors for them to explain better to you whatever it is you are not clear about. Avoid prostitution. I'm not saying you shouldn't do the prostitution, but avoid having unsafe sexual intercourse with different people because you might be prone to infection. Then another thing is that get married early. Yes, it will also prevent you entering the menopause and you are finding it difficult to get pregnant. Then another one is practice safe sex by using your condom when necessary. Then treat infections with your partner. Don't just treat infections alone to avoid reoccurring infection. Yes. Then also have frequent intercourse. Have frequent sexual intercourse. It will help you. It will help a lot. So with these 3 points, I hope I've been able to make us understand that women are not to be blamed. And these are the preventions we need to take, precautions we need to take, management we need to take to help manage this infertility condition. It is very rampant in our environment. It is very rampant in our environment. There are drugs we can use. There are solutions we can go to. There are solutions we can reach out to if you're not if you're not seeing your menstruations, there are things you need to do. Go see your doctor. Your menstrual period is ceasing and you just felt it's normal. It is not normal. You are not having ovulation. It is not normal. You need to go get yourself treated to prepare yourself for that baby. Yes, for that baby. So thank you so much for watching our videos. Thank you. I hope with this you understand. I hope you understand what I've said so far. Thank you. Have a lovely day. Have a lovely night wherever you are watching from.